Today, I'm honored to co-present with Linda and Ronnie from Concierge Home Care.
Even from a therapy perspective on what we could do for patients virtually. And I think the first time it really came to light for us is we were sitting and we were meeting with an orthopedic physician that was working on a special bundle, and they were trying to figure out, how do I care for patients most effectively, and especially with less costs. And they were getting ready to sign a contract with a company out of California that was going to be completely virtual care via their therapists. And immediately I was like, wow, we're doing virtual care with our nursing team. This is a great opportunity for us to expand with therapy. And without giving away much of that secret, and because Ronnie's going to speak to it as we progress throughout this presentation today, again, I was pleasantly surprised at the effect that we could have to get better outcomes with less costs. You know, it really just meets our mission statement at Concierge Home Care has always been, we care for people who care for people. And I moved away from do the right thing by your patient, which obviously is very, very important, but really do the right thing by your team member. And adding virtual care for our team members has been a great opportunity, one for them to, to stay home and do visits from home one day. So Cindy to Concierge Home Care is really a communications platform. So one of the neat things that we're able to do is push monthly educational messaging. And even as everyone knows, this past week we had a hurricane, so we were immediately able to send out messages via text to every single patient that we have on service with us right now, and just in the preparation for that, as well as giving out daily educational advice and where they needed to go and how to contact us and do all those pieces. We're actually able to even touch any patients that we've had. So on an average, we are admitting anywhere from 10 to 12,000 patients on a yearly basis. And at any moment, I can send out a push text message that hits all 10,000 of those patients, and even some of their loved ones if I have their telephones in our system. So it's a wonderful way to brand and communicate. We actually also set up protocols that go along with all of our educational processes. So we're able to tie the education that my nurses are doing in the home on a daily basis and reinforce that, and push videos to our patients to reinforce the education that they're receiving. So imagine back in March as COVID-19 started to hit, how instrumental having that ability and capability to push message and warnings and education about what was going on through COVID-19. It was just something I never thought we would need, but it was a wonderful asset to the care that we were able to provide. I think everyone was touched during the months of March and April as fear kind of transcended all of our patients that we care for, as well as our clinicians. And having the ability to say to a new patient that you knew desperately needed your services, but they were very fearful of even healthcare workers coming into their home. So having the ability to say, I'll tell you what, we can do some virtual visits to get started, develop a trusting relationship with that patient, and then be able to get in the home and care for the patient the way they needed. Teach them about the type of PPE and what we do to prevent spread of anything, and in order to care for that patient. With Cindy, we were able to accomplish that. We were also able to incorporate immediately our virtual visits into our therapy disciplines. And even we, for us, virtual care, as we have implemented over the last, year and a half to 2 years, has just become part of our care planning. So every patient that we see, it's not an option on how we're going to do virtual care. It's part of the care planning that we do with that patient and throughout that period. And they see it as an added benefit and touch point of how we accomplish the goals that we set with those patients from day one. Also, I was just going to say, we've been able to, I I hate to give a little bit of a highlight, but I'm going to do it anyway. I will tell you, I think everyone that's been in home care, and we look over the years, I've been in home care longer than I'd like to admit, but we certainly all know how many visits it used to take us to accomplish the goals needed for a knee replacement. And I think there's lots of folks that are listening to us today and can remember when we did 18 to 20 therapy visits, and then we started to figure out how do we care for a patient and get the same kind of outcomes in 14 to 16 visits, and then down to 10 visits. And we all know, especially if you're involved in CCRJs, that we're currently now doing total knees in 6 visits with no nursing visits, just 6 therapy visits. I'm really proud to announce that Ronnie's been able to actually accomplish the same outcomes on patients with 3 in-person visits and 3 virtual visits. So times are changing, and we all have to figure out how to have magical moments, and how do we accomplish the set goals and do that with less costs. And it's really what Triple AIM is about, and better patient outcomes and better patient satisfaction. And I think Cindy has helped us accomplish those goals. Just last week, we had a situation where we had a patient in a rural part of Okeechobee County that had some demands for speech therapy. And we were extremely fortunate to be able, they had gone through every agency that was licensed to service that territory and unable to get speech therapists out to service this patient. So really exciting that we were able to use our virtual platform to be able to meet the needs of this patient. So again, it's just another out with the old, and we would have never thought about that as an option. And we do some Part B under with our home care agency as well. So we also have been very fortunate that under the current waivers that we have, we're able to bill for some of those visits that we're doing under the Part B side of things. So, you know, again, I just mentioned we use virtual care across the board, you know, not just with our COVID-19 patients. You know, I would tell you we are doing approximately 1,300 to 1,500 virtual visits on a monthly basis now. So, a good 20 to 30% of those visits are now therapy visits. So in the past, where we saw it just primarily as nursing, we're seeing more and more virtual visits that are occurring with our therapists. And as our therapists are doing that, they are so surprised and pleasantly surprised at how well their outcomes on those patients are increasing with those virtual visits. And our virtual therapy teams are identifying things that our nurses are missing and what their therapists are missing when you are in the home. It's amazing when you sit and you're concentrating on that patient face to face without some of the distractions that do occur when you are doing an in-home visit, what you can uncover. Especially through med reconciliation and med management. It's amazing what we can identify. We every Monday actually do a therapy call where a lot of our managers will get on the call and we'll review what we had for the week. And every one of those calls, we are giving example after example after example of where we prevented a rehospitalization that occurred over the weekend. We probably do more virtual visits on our weekends, on our Friday, Saturday, and Sundays than we do all week, just because we know that those are significant days where rehospitalization rates are higher when you look at some of your data. So for a lot of our bundled projects, we do tuck-in calls on Fridays and Saturdays and Sundays virtually to try to make sure that we are meeting the gaps of those patients that, you know, typically agencies are working Monday through Friday and do a lot more visits, and we can touch the patients. And likewise, even from our therapy team, it gives them that ability to ensure the patients are doing what they're needing to be doing during the week as we check on those patients, and that on the weekend they're following through with the care planning that we're doing to prevent them from falls, preventing them from making sure they're keeping up with whatever conditions they're supposed to be agreeing to or performing from their physician's orders.
Yeah, as far as therapy goes, you know, we've been pleasantly surprised at the reception that our therapists have had. You know, when we first rolled this out just over about a year and a half ago, you know, therapist responses were generally, hey, I'm a physical therapist. This is a physical job. How can I do this face to face, you know, without being in that patient's home? But we've really seen that our therapists have taken the education that they work so hard to get, and they've really used this as an opportunity to shine. Like Linda said, we've had therapists on calls with patients catching vital sign issues, blood sugar issues, wound care issues, you know, again, medication issues. These are all things that sometimes therapists will overlook, but at this virtual platform, you really sit down. It's kind of an intimate time to talk to them and see things that you might not have seen. And then again, we've prevented rehospitalization. So not only are our patients appreciative, but the referral sources are also appreciative that we're keeping these people out of the hospital by having these extra touch points with them.
It's motivation, and that's what a patient needs, is motivation. So again, I can't say anything more than 100%. For me, it worked very well.
I think we've also, you know, Linda mentioned the total hips and total knees. We don't just do this for these post-op orthopedic patients. You know, we use this for physical therapy, occupational therapy, and speech therapy. And while this really lends itself really well for those bump projects and those total joint replacements, we're able to, you know, contact these patients a lot quicker and get quicker results. But we can do this for every diagnosis that we have for therapy and every discipline across the board. So it's really been easy to roll out because there's so much ease of use across every discipline. We have had speech therapists who say that it's enhanced their quality. Occupational therapists who they work so hard in the home to do this functional training, but they're not sure if the next day if these patients remembered, right? You might teach somebody how to get in and out of the bathtub the right way. Well, how'd that bath go the next day, right? So to follow up and to really re-educate, reinforce everything that we've done in the home, it's really been a game changer for us. I really think that not only the therapists love it, but the patients love it, the referral sources love it, and it's been a game changer for us across the board.
I can attest to that as well. I remember the first time our speech therapist who I've worked with for the last 20 years, and she called me on a Saturday afternoon. She was so ecstatic about her first virtual visit. She was like, I can't believe how good this is and how well it worked. So she still to this day does approximately 8 to 10 virtual visits on a weekly basis. And certain patients, you know, apply more than others, but it's amazing what she can get accomplished. And as we all know, under PDGM, with the limited ability that we have sometimes to effectively have a margin when we care for our patients, it's just a great opportunity that I can still have the same amount of touch points with a patient as I did pre-PDGM, but more cost effectively.
I think we've also seen that our patients, we under PDGM, I think a big fear is that people are going to lose visits. They're not going to have that kind of touch point. And not only are we keeping the touch points that we need to keep, we're actually able to add almost this VIP service line, right? Where the patient has an instant contact to not only their nurses, but their therapists, and they can see them face-to-face, video-wise. All they have to do is press the button to open the app and press the button to call, and somebody's going to answer and be able to provide quality education for them or reinforcement to really get them what they need when they need it. So it's been awesome for everybody.
Having contact on a set was very rewarding. I didn't have to worry about anything, and I was able to talk to them in my PJs, didn't have to go out anywhere, and it just made me feel a lot better that I could enjoy my weekend, though that there was nothing really wrong with me. It was all just normal procedures happening to me.
You know, I sit here when I talk about I think about different keys of success, because I will tell you, you know, we've been implementing, we started virtual visits, I think, before most people were even thinking virtual care as an answer for PDGM. You know, so we are extremely, extremely fortunate that we've worked through some of the keys to success, if you want to say. When I first thought we were going to do this, I thought everybody was going to be so excited, and I'd have champions all coming to the table going, oh, I want to do virtual care. I want to do virtual care. It definitely took a lot longer, and I had to kind of take a step back and think about how do we incorporate this. So listen, there is no question that Cindy and virtual care is the answer to the care we're providing. But the big questions are, and I think the key to success on whether you're successful or not is how you operationalize that and how you get your team to encompass and really understand and do some trial and error to figure out what works. So I initially threw it out there for all of my staff to be able to do, and without real process behind that. And then I found I needed to really put put my clinical leaders in charge of this. And Ronnie, and I have an amazing nurse that I work with who is our clinical director, and we set this really under a project management process. And how do we incorporate it into everything that we do? So when we started to really have success is when we started to hire specific nurses and therapists that were on our virtual care team. So they're very trained and detailed into what is that magical moment for that visit. What is the visit? Our virtual visits last anywhere from 10 to 15 minutes, and there's really a, I hate to say, skill or use that, but there is an educational moment in that. There is a follow. There is a skill that we're providing in those virtual visits that we do. And one day I hope that Medicare will see the value that we're bringing to the table from a home care perspective and allow us to bill for some of those. We are also now starting to see some of our commercial insurance companies realizing that there's value to these virtual visits, and we're finally getting some reimbursement on that aspect for that care that we're providing. But it really was, how do we incorporate this into everything that we do? How do we get not just our nurses out in the field and our clinical managers and our utilization team and everyone, even our referral sources, our sales team, to understand virtual care as part of who we are. One of the, I think there are some benefits in life for everything that we go through, and COVID-19 has certainly affected the way that we think about delivery of care, how we effectively think about how we manage the care of our patients. And I do think we've probably taken virtual care further in the last 3 months than we did in the last 10 years. So that's been exciting, because I think it's made folks open their mind as well as their thought process to how to make this more successful. And that just kind of drove us up. And you can see our curve as we started to incorporate virtual care, especially last August, getting prepared for PDGM. And we kind of have this line that goes straight up this, but during COVID-19, we saw that even go further up. And we've seen everyone just, really envelop virtual care and how we do it. And it's just an extra set of eyes for us as we look at alternative payment models and partners that are looking at ways to provide better care in a more cost-effective way. It allows us to have better opportunities from a marketing perspective as well to those partners, and more discussions and real discussions about how we are a partner in trying to figure this out, and how do we figure out how to effectively care for patients more cost effectively.
What we're hearing is there's not just the physical benefit, but the emotional benefit. And as you could see, obviously amid COVID-19, there's plenty of patients who feel that using the Cindy virtual care or telehealth platform is making them happy, but it's also making their children, whether they're nearby family caregivers or remote family caregivers, it's making them happy because everyone is feeling that they're getting safer, more convenient care, especially as they're trying to restrict as many in-person visits as possible. So you can see a couple quotes such as here, which is, "This helps me still get my therapy and see my nurses without possible exposure." Someone else says, "I can't believe I can still exercise with you without someone even coming to the house all the time." And then the second from the top where it says, "I can still take care of me and make my children happy at the same time." So it's wonderful to see that there's that emotional and physical benefit for the patients as well as their family members too. And on the flip side, the clinicians, as both Ronnie and Linda have articulated, are very positive about this. In working with a regional player that's based in Texas, we heard from their clinicians that they looked at the fact that they had already implemented telehealth because of PDGM and before COVID-19 as really a proactive thing that they could readily bring to their patients, and that they were happy that their agency was thinking outside the box far enough in advance to have this already implemented when it definitely became something which was practically essential, if not yet critical, during COVID-19. And Ronnie had pointed out that what's very impactful about virtual visits is this idea where you can continue that care and that you don't have to wait to the next in-person visit, and you can eliminate or just try to at least, downplay any chance of the patient regressing, because you can check in with them and have them work on something on their own, whether it's you're sending them a message or you're doing a virtual visit with them and making sure they're on track before the next visit. And I think what's so important is this last quote on the page, which is really about the social determinants of health, right? That look of concern, almost desperation, disappears from the patient's faces when they log onto the virtual call. This is something that they're looking forward to. They're building a relationship with your agency and with your therapist. And the virtual check-ins really helps solidify that relationship. And as Ronnie pointed out, it's something that essentially makes them feel like they're getting VIP care from you that they couldn't get from any other agency which is out there that's not using telehealth today.
Spending a lot of time today talking about therapy and virtual care, but it also allows me the ability where, we cover such a large area, but my WONC, my wound care specialist nurse, can actually virtually, call in with the nurse at the bedside and make the recommendations and move on to patient's care right away. And that actually, the patient in the home is so excited because we're bringing that specialized wound care nurse straight into their home with our other nurse. It's been wonderful for us to even under some of these waivers now, when we go out to see a patient that can't get into their doctor's office, to bring that doctor into that patient's home when that patient may not have the capabilities to do that. We've also been able to do that with respiratory therapy with COPD patients or nutritionists in areas where we just couldn't afford it. You can't afford it under PDGM, but Cindy allows us the affordability to do that. I also think about, I was walking through one of our offices not too long ago, and we like to use Cindy, right, even as a welcome call that my clinical managers do with their patients. And I heard a patient calling in on the Cindy app to the clinical manager, and she was so excited because she had a wound on her foot and her wound was doing better, but she wanted to, here she is with her phone showing my clinical manager in the office, and you could hear her throughout the office talking on the computer. Look how good my leg looks, and I can't believe how much I love Kendra. She's done such a great job. And it was just exciting to see, one, my clinical manager have the ability to connect with that patient in a way that she was never able to do before, because that visibility and seeing someone across the screen just it's so much more meaningful.